Hello, good evening, Facebook fans. So again, this is Doc Rojo, and tonight I'm going to talk to you about two inflammatory diseases of ulcerative colitis and Crohn's disease. So these unfortunately are increasingly common, and basically they affect over a million Americans every year. They are also something that unfortunately leads to a much greater risk for colon cancer, especially the inflammatory ulcerative colitis. It also raises the risks of hepatitis, cirrhosis, arthritis, hi Raj, nutritional deficiencies, fistulas. Now that's where one segment of intestine joins to another segment that it's not supposed to by making a little tract from one to the other. And those can be very painful and usually have to be surgically removed. Hi, Gravinder. And also, they can contribute to skin, eye disorders. Pretty much a lot of times when somebody has an inflammatory condition such as Crohn's disease or ulcerative colitis, the increased activity of the immune system basically ends up having other parts of the body that get affected, such as the lungs and the skin and the eyes and liver and other body parts. That's a very common theme when looking at the inflammatory diseases, and Crohn's and ulcerative colitis is no different. So what are some of the symptoms of Crohn's and ulcerative colitis? Now, you might find that if you go back and watch the irritable bowel syndrome presentation I did a few weeks ago, you'll find that there's a lot of similarities in the symptoms of the irritable bowel and the more serious and more deadly inflammatory bowel diseases. And this is, again, one of the main reasons why I give these talks as educational only and informative, because these kinds of discernments to find out if something is relatively benign or more troublesome or more serious really needs to be done in association with your own primary care physician and looking at your symptoms and looking at the course of disease. And that's, of course, I can't do that through my little video camera here. There's certain limitations to technology, of course. But anyway, so how do doctors make the diagnosis of ulcerative colitis or Crohn's disease? Well, the main thing is obviously symptoms. So if somebody is having Crohn's disease, they often have prolonged bouts of diarrhea, oftentimes with abdominal pain, and sometimes there's bleeding associated with it and sometimes not. And usually, as with most all autoimmune diseases, there's a lot of fatigue. And because of, one, people not feeling well and also the inflammation of the gut, there's usually some weight loss. And sometimes, as with other immune system problems, fevers can happen. And with Crohn's disease, this can happen off and on for many years with this crampy belly pain and these other symptoms before a formal diagnosis is made. With ulcerative colitis, the symptoms are actually pretty similar. They get colicky abdominal pain, and kind of because, oh, here's something I forgot to mention. One of the main differences between ulcerative colitis and Crohn's, even though they're very, very similar in the fact that they really attack the intestinal wall and the intestinal lining, the thing is that ulcerative colitis pretty much tends to affect the lower segment of the colon a lot. And that's generally the main area that is affected is the colon, ulcerative colitis, ulcers in your colon, right? Whereas Crohn's disease is a little sneakier. It can affect any part of, here's your expensive word, alimentary canal. Basically that means your gut, anywhere from your mouth all the way through all the intestines down to the anus. Any one of those spots can get infected by inflammation. And so sometimes we call it cobblestoning. So like one little segment would be affected, a whole bunch area would be normal, and then there'd be another segment over there and so forth. That tends to happen more in the Crohn's disease. So when you're looking at the symptoms of the ulcerative colitis, the colon inflammation, well, you get symptoms that are associated with colon inflammation. So one of those is tenesmus, another fancy word, but all this one means is you really feel like you gotta go. There's some urgency to going number 2 in the bathroom, as well as some colicky abdominal pain. Colicky means basically intense cramps and then it lets up, and then you get intense cramps again, then it kind of lets up. So it kind of is what we call colicky. It kind of comes in intense waves. Yeah, and also urgency of having to use the bowels, along with the other autoimmune diseases, fevers and fatigue and weight loss, and having to very much manage activity levels, can go a long way with the symptoms. And with ulcerative colitis, again, chronic diarrhea for over 4 weeks, often with blood in the stool as well. So, sounds terrible, right? And it pretty much is. So, the folks who are suffering from these chronic relapsing diseases, basically, in order to get a good diagnosis, they go to their physicians, we'll get some labs. There's no lab that significantly at the moment says, oh, you've got this or that disease. In fact, we're kind of looking more at markers of health, like how is your blood count? In other words, have you lost all the blood, or are you kind of okay? Same thing with the iron. If someone's iron level is low, B12 often can get low in these folks because their bodies are just not absorbing as well as usual. Liver and kidneys and markers for inflammation, SED rate, CRP, that sort of thing. And so those are just part of the overall picture. And believe it or not, all those labs, depending on where the person is at in the course of the disease, may be totally normal or abnormal. So it just kind of gives a picture of how severe is a person suffering at the moment with it. But the main thing is basically a scope, where they either put a scope down from one direction or up from the bottom end. And sometimes they'll use a wireless video camera where they swallow a pill and it kind of goes down and it takes pictures all throughout, which is pretty neat, fascinating technology that they can do these days. But the main thing is really with a biopsy, and you can only get there with a scope. So if somebody's at home and is suffering, again, that's one of the reasons why it's vitally important that you also engage with your own primary care giver if you suspect any of these conditions to be a part of it. So what kind of risk factors? How would you know that you might be at a higher risk for developing one of these two conditions? Well, there's a few different things, and we'll go into a little details on there about different risk patterns that are associated with these. And if any of you are following Dr. Greger's nutritionfacts.org or Dr. Barnard's nutritionmd.org or any of their works, you'll find that a lot of these risk factors are not terribly surprising as we go into it. So, first of all, genetics. So, unfortunately, we can't really help the genes that we're dealt. You can't really choose your mom or your dad, right? And if you have a family member that has one of these two diseases, well, if it's any family member, you're at 10 times higher risk of getting it yourself. And if it's a first-degree relative, in other words, mom, dad, brother, sister, your risk, unfortunately, is 20 to 35% greater risk. So anybody who has a family member or who's got this disease and is planning to have children might especially want to pay attention to some of the other controllable lifestyle things that can play a role as well. As far as other genetic traits, it seems like Caucasians tend to be at higher risk. And then a particular subgroup that unfortunately we talk a lot about in medical school is the Ashkenazi Jewish population. Those folks unfortunately have about an 8 times greater risk of these two inflammatory conditions than other people. But do not despair. Again, you can't choose your genes, but you can help influence how those genes express themselves and whether things are causing problems or whether you keep those genes quiet and not having trouble. So, when does these conditions present? Usually it's a disease that starts in the youth. Symptoms can start as young as age 15. Of course, this is a generalization, sometimes maybe even sooner, but 15 to 35 is about the right timing of onset of these symptoms. And again, this is very common amongst all the autoimmune diseases, that they tend to be starting in youth as well. Folks that have a lot of NSAIDs, NSAIDs are one of those medicines we call Motrin, ibuprofen, vitamin M, if you happen to be in a area that gives out Motrin a lot. And this is one of the other reasons why I don't necessarily prescribe the NSAIDs as much as some of my colleagues might, because I know some of the risk factors with it. The NSAIDs may have something to do with the lining of the intestines. They certainly can increase bleeding if somebody has already got a problem and is prone towards bleeding. And they thin the lining of the gut wall in the stomach. And so regardless of what the mechanism is, NSAIDs may trigger inflammatory bowel diseases, or they also may trigger a relapse in somebody who's already suffering with it. So although they can be good for pain relief, maybe not as good in this condition as something like a turmeric, which can help not only control pain, but also decrease the likelihood of remission. Tobacco, that kind of goes without saying. Tobacco is extremely inflammatory to anybody. And then this might, if you watched my video on the type 1 diabetes, you might have noticed there was something about whether people breastfed or not, and developing the risk for type 1 diabetes, another autoimmune disease in that case. Well, it turns out that women who breastfeed their children are giving them a lot of good protective things for life, and one of those is that the risk for ulcerative colitis is 25% lower in babies who've been breastfed, and the risk for Crohn's disease is about 35% lower as well. And so mothers who are able to can give their children a good gift with the breast milk as well. Obviously, there's exceptions to every rule, but these are things that we can potentially help out with. Another thing is low vitamin D levels, and there is some interesting research that Dr. Greger reviews in the issues with vitamin D and how well it actually can help with these inflammatory diseases, and I'll cover that more in a few minutes. The Western diet pattern. So by now you probably are familiar with the SAD Western diet. That's the standardized American diet. In other words, SAD, because this diet pattern is associated with so many chronic diseases, and unfortunately these two inflammatory diseases are just another side effect of the standardized American Western diet. There was a study that was done, for example, in Japan. They were comparing the original diets of the folks that were in this country, in this area, with basically over time. And as the Japanese diet got more and more westernized during that time, from 1966 to 1985 specifically, basically they went through all of these different dietary components to try to figure out, okay, well, we're seeing a higher rate of these diseases. What is it specifically in this change? What did people change that led to greater risk for the diseases? And the strongest predictive factor of whether somebody's going to come down with these inflammatory bowel diseases was the animal protein. Not terribly surprising. And there's a lot of things in the animal protein that tend to be inflammation promoting. And one of the biggest things on there is sulfur. And you think, wait a second, what is steak and red meat and chicken and fish? What do all these animal proteins, have to do with sulfur? Well, it turns out that these animal proteins naturally contain hydrogen sulfide and other sulfur compounds in there. And so what? Well, this stuff damages DNA, and most importantly, it also interferes with the good bacteria in the system. So the good bacteria that are in our gut system, well, they are constantly taking fiber and making a very lovely protective component out of it called butyrate. So the butyrate basically is kind of like a protective coating for the intestines. And this is made by the beneficial gut bacteria. And so when people are having all this hydrogen sulfide going into their system, basically it's kind of shooting down the protective butyrate lining, so to say. And it especially causes what we call leaky gut. And Dr. Greger has some really nice presentations talking about the role of hydrogen sulfide and the leaky gut theory of all of these diseases. In my way of thinking, it's not terribly surprising that when the lining of the gut is broken down and the normally tight junctions that go between basically having the stuff inside the intestine not get outside too directly. In other words, you're supposed to have the junctions be very tight, and if there's too much leakiness in between, well, then sometimes things that aren't supposed to get through and get through. And what's just on the other side of that gut intestine lining is these giant patches called Peyer's patches. And so very easily, if the gut lining is a little bit disrupted and so forth, then some of the things can weasel their way through, and then guess what's right on the other side is the police. The immune system is right there in these Peyer's patches, and it says, "Ooh, what are you, milk protein? My goodness, I better start attacking you." And next thing you know, you got one of these inflammatory diseases, Crohn's, ulcerative colitis, arthritis of various sorts, and so forth. And so, not very surprising, once learning more about this gut lining and how important it is to our health, it makes it a little bit easier to see why some of these inflammatory conditions respond so well to dietary interventions and food modifications. So where do you get sulfur from? Okay, so the biggest sources of sulfur in our diets right now is meat, alcohol, particularly sulfited wine, who knew? Dairy, eggs, and certain dried fruits. And one of the ones that is the most notable of the dried fruits, at least in my grocery shopping experience, is apricots. Basically, the sulfur dioxide is added to the dried apricots to make them look a little brighter and more yellow, therefore more appetizing for people to choose. And so if you're picking your dried fruit, please double check to make sure there's no dusting of sulfites on there as well. Sulfur dioxide, I think, is how it gets to. Alrighty, so covered all that. The next thing is that the people who have these diseases, when they eat more red meat and processed meats, not only are they really risking the colon cancer even more, and we'll probably get into that in more detail in another presentation on colon cancer someday, but it also raises the relapse rate by a lot. So over 5 times the relapse rate in the folks who had more red and processed meat. So highly recommend staying away from that anyway, but especially if someone's got inflammatory bowel diseases. And then there was a dietary study in which people restricted all these sources of sulfur in the diet and also restricted the sources of just regular old animal protein in general. And basically, the control group had some relapses, but the folks that had this dietary pattern basically did not have any relapses of it as well. Hi, Randy. All right, so next culprit. People with the inflammatory bowel diseases, like many other autoimmune diseases, also are tending to be very sensitive to dairy. In fact, folks that got rid of dairy altogether often helped or improved the symptoms considerably. And there may be other food sensitivities as well, such as are found in the rheumatoid arthritis folks, but we don't have enough studies yet to tease apart all of the different food sensitivities. Stay tuned, I'm sure there'll be more research in the future on that. More things that can contribute to this inflammatory bowel disease. So a high-fat diet. And one that has a lot of animal proteins and cholesterol tends to be very high in omega-6 fatty acids. So sometimes people will go to the store and they'll find omega-3 and omega-6 supplements. Well, there's really no need to supplement omega-6s. Most folks are getting lots and lots and lots of that already. But as far as omega-3s, good sources of omega-3s, which are protective against things like the inflammation disorders, are things like flax seeds, chia seeds, and in those that can have them, hemp seeds I think has it as well. But anyway, so the omega-6 fatty acids, there is a wonderful article in Wikipedia that I'll try to remember to put in the comment section below this, that basically looks at omega-3s and omega-6s and how they contribute to inflammation. So the short version is imagine there's a little factory and it's got some steps, little cogs along the way, and at the end of all that it spits out either things that cause inflammation or things that lower inflammation. And so you go into your factory and you pour in a bunch of omega-6s into this little machine and it goes clunk, 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 clunk and spits out inflammation. You go into your factory and you pour in omega-3s into the same machine, same machinery, and it goes clunk, 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 and it spits out less inflammatory factors. And so the average American diet has about 18,000 lots more omega-6s than omega-3s. And so it's no wonder that we have a tendency overall as a society to have a tendency towards these inflammatory conditions. Other foods that contain those omega-6s to watch out for are a lot of the plant oils, basically sunflower oil, safflower oil, and corn oil were the ones that were mentioned specifically in this resource. But basically, again, those omega-6s pour into the system and directly raise inflammation, whereas the omega-3s, going in the same system, compete with the omega-6s and lower inflammation as well. As speaking of fats and oils and so forth, now we get to the some of the quintessential American foods that a lot of people seem to love and enjoy. But a lot of these processed foods that are available in our stores are loaded with partially hydrogenated oils of various sorts, usually partially hydrogenated vegetable oils. So what's the problem with all these things? Well, they also highly increase the likelihood of getting not just the Crohn's disease or ulcerative colitis, but also other problems such as heart disease and other things as well. So where are these partially hydrogenated fats found? Fast foods, fried foods, margarine, baked goods, and packaged foods. And for example, folks that have fast food twice a week had 3 times greater risk for Crohn's disease and 4 times greater risk for ulcerative colitis. And if you look across the board at the other inflammatory diseases, there was a similar study that showed that kids that ate out at fast food, much higher rates of asthma, by the way. So it's kind of a overall inflammatory raising proposition out there. And speaking of all these packaged foods, well, we're kind of unique right now in this day and age in that we've got so many chemical compounds that we've never ever been exposed to before in the whole history of humanity, thanks to our better living by chemistry, right? And so there were some components that were particularly troublesome to the body. And one of the main reasons we think some of these chemicals are so destructive is they disrupt the good guys. We've got lots of bacteria in our gut, and they're kind of like fighting a little war, you know, are the good guys winning, are the bad guys losing, or something like that. And so there are certain chemicals that we take in our diet that we're unwittingly shooting down our good bacteria. So ping, 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 sorry guys, next thing you know, or it gets disrupted and all sorts of problems are happening. So one of the things that is most commonly linked with Crohn's disease and ulcerative colitis is this chemical called polysorbate 80. Now, where do you find such lovely stuff as polysorbate 80? And again, try to avoid it if you can, but unfortunately it is found in things like ice cream, Crisco, Cool Whip, many condiments, and some cottage cheeses as well. And so if you're in the markets, try to stay away from those things in particular. Again, that's ice cream, Crisco, Cool Whip, many condiments, and cottage cheese. And the key word you're looking for, and this is why reading labels is so important, is polysorbate 80. Generally speaking, it's a good idea anyway that when you're choosing foods, especially if you're choosing ones that are a little bit processed or something, try to make sure you really know what each of the ingredients actually is. If it says something like dates and raisins, that's probably not so bad, but if it's got all these long chemical names, usually not necessarily as good for you. Another one is sucralose. Now, sucralose is a very common sweetener, and in the folks that were having it, it increased the rates of inflammatory bowel disease 12-fold, so that's quite a bit. Titanium dioxide, this was another one that kind of shocked me when I learned about it several years ago. Titanium dioxide is what makes paint white and opaque, and I was actually kind of shocked when I realized that we're essentially having the same ingredients as are used in paint in our food supply, basically to make it brighter and whiter and prettier to choose from, so that when you're reaching for that salt shaker or the powdered sugar for the donut or something, if you've got that titanium dioxide in it, it sparkles and just a little extra whiter, and so you might choose that more than the less appealing stuff that's right next to it that does not have titanium oxide in it as well. So something else to watch out for. I've also seen it, by the way, in basically those powdered creamers that people use in their coffee. All right, there's a couple other things. The last chemical to watch out for and try to reduce is maltodextrin. So where is maltodextrin found? Well, this is found in Splenda. It's found in snack foods, certain salad dressing, and fiber supplements. And this is another reason why it's far better to eat fruits and vegetables and whole grains and all that kind of stuff, rather than leaving it up to the companies to try to extract fiber and prepackage it into a little powder supplement or something like that, because unfortunately a lot of these things get sweetened with either artificial sugars or things like the maltodextrin or Splenda and such as well. And you'll see that in several brand names of that. So again, labels, read them, know what they mean. Very, very important for your health. All right, next, fiber. So in folks that were having more than 15 grams of fiber a day, they cut their risk for Crohn's disease in half. And it was turned out that fruits are especially productive. Even the folks that are already diagnosed with these conditions, the more fiber in general, the less likely people are to have a relapse. And final thing that's associated with these two diseases is high sugar diet. Now the question is it because of the other things that happen to be commonly located with the sugar? Like if you're having candies, there's usually little artificial colorings and things like that. If you're having sodas, there's all sorts of other things that go along with the sodas as well. So we don't know exactly where all the ties are, but it seems to be a link or an association. And then whether something causes it, we'll probably find out later on. Alrighty, so hope you're having fun today with learning about these diseases. Next section is to go into some of the things that can be helpful for folks who have ulcerative colitis or Crohn's. Of course, I'm always going to talk about a whole food plant-based diet as being a wonderful additive treatment to everything. So what are the usual treatments for Crohn's and ulcerative colitis? Well, it includes a whole host of medications that suppress the immune system and can cause all sorts of lovely side effects. I'll save that discussion for right now because that's better to have in private with your own private physician. You can read about that as well, but basically medications help control the symptoms and relapsing a little bit, but again, they don't control it all the way. Surgeries, unfortunately, because of the risk of colon cancer, a lot of people with ulcerative colitis have a great deal of their colon or entirety removed in order to reduce the risk, or significantly have large chunks of intestines taken out. Unfortunately, people with these conditions are subjected to many, many, many bouts of surgeries and usually end up in the hospital for long times, unfortunately. Also, antibiotic treatment can be used as well to help control some of the invasion of the bacteria. Vitamin deficiencies tend to be very common in folks with these two conditions. A lot of it is because the gut, when it gets so disrupted, it sometimes has a hard time absorbing some of the vitamins. In particular, some of the fat-soluble vitamins, such as vitamin E and so forth, basically are sometimes a little bit lower in these folks. So things that can be helpful for beta-carotene would be carrots or carrot juice, vitamin C and vitamin E, so whole plant sources of that, such as mangoes, for example, nuts, seeds. Selenium, you can find that in Brazil nuts. Zinc is found commonly in some of the nuts as well. B vitamins, sometimes it can be helpful to have a little extra supplement. Here's an example of a B complex kind of thing. B12 tends to be low in these folks as well, so here's an example, B12. And by sometimes having some extra supplements in these particular conditions, sometimes that can be very helpful for boosting the body. I found with my own condition that some of the medications that I was taking basically interfered with the absorption of the beta-carotene, and so by adding either beta-carotene or vitamin A at some point along the way, or actually once I discovered how easy it is to get it from carrots, you look at your label and you think, oh my gosh, 10,000 units, that's got to be a lot, and then you realize it's like half a carrot or something, and it's like, man, just have some carrots or carrot juice and you get it, and plus all the other micronutrients along with it. By the way, a word on vitamin supplementation. Folks who have a history of smoking should not take vitamin A supplements, or sorry, that's because basically the vitamin A, if it's put in the body directly, can increase the rates of lung cancers and such if a person has a history of smoking. So far, far better to get in the form of beta-carotene, because if you're eating it in the carrot, your body will use what it needs and leave the rest behind. Also, there's a great link between vitamin K and these conditions, and so people that have them would especially benefit from foods that are rich in vitamin K, which is especially your dark green leafy vegetables. And we mentioned the omega-3 fatty acids a little while ago, found in chia seeds, flax seeds, and so forth. There's another plant that's been studied in controlling symptoms of ulcerative colitis and Crohn's, and that's Boswellia. Boswellia serrata. And that basically contains some acids that inhibit some of the enzymes in the gut that trigger the inflammation. And one pilot or case study showed that it seemed to be as effective as some of the medications that are out there. So that may be a good adjunct therapy as well. And unfortunately, I don't know any other way to have that other than the supplements as well. Probiotics. So in the gut wars of bacteria versus bacteria, probiotics can be helpful as well. The ones that were studied specifically were Lactobacilli, Streptobacilli, Bifidobacterium, Saccharomyces, Boulardii, yeah, something like that. So anyway, the idea is a group of bacteria that are good for the gut flora tend to be helpful. So the idea is that a lot of times in these disrupted bacterial communities, pouring lots of extra good bacteria or good guys into the system tends to help keep the bad guys a little bit at bay, a little bit more. So a lot of autoimmune diseases, and these are included, seem to improve with reduced stress. And so stress reduction techniques can be very helpful for managing them as well. And then, hi Roseanne, there's also a study that showed that vitamin D was helpful as well. So they basically took these folks with ulcerative colitis and Crohn's, and they gave them a little bit of vitamin D, and they gave them like 1,000 units a day, and they didn't really see too much difference, maybe a little bit. But when they gave them 2,000 units a day, it kind of kept going up a little bit until the target value is reached, which was about 75 nanomoles per liter, basically. I usually tell my patients I'm aiming for 40 to 75, but if you're out in the wild without too much clothes on to block the sun rays hitting your body, most people end up actually eventually reaching 75 or 100 even from being out in the sunshine. So anyway, what happened was when the patients got to that magic normal for a species number of units of vitamin D in their bloodstream, well, there's a huge drop in the inflammation and that leakiness of the gut that I was explaining. You know, the tight stuff wasn't supposed to let stuff through, and then the leaky gut was the trouble. It caused this stuff to kind of leak through and get caught up by the immune system, which is right there, right next to the gut, by the way. Well, it found that when the vitamin D levels became normal, the gut leakiness and the symptoms significantly improved. And so this might be one of the reasons why folks that live in northern hemispheres tend to have a lot more inflammatory bowel diseases as compared to the folks in the south. And I'll tell you, living down in the Florida area, there's a lot of vitamin D deficiency here even now because we're not outside all that much. You know, you don't want to get skin cancer, so you stay indoors and you wear clothes and all that kind of stuff. So even though we're a little more southern and maybe have just a little bit more access to vitamin D because after all, it's a sunshine state, right? There's some barriers that can get in there. So there was another exciting study that was done on wheatgrass juice. This was a pilot study, and Dr. Greer has some great reviews of it. And basically what they did was they gave these folks about 100 cc's of wheatgrass a day, and that's kind of like roughly somewhere between, I think, like a third and a half a cup or something like that. And they chugged it down, and 90% of the folks that were in that study improved with their symptoms. And again, if you look at the lining of the gut and how everything works, again, not too surprising that these dark green, especially dark green leafies in the form of wheatgrass juice, tend to be beneficial. Another one of my favorites is turmeric. In this case, it was curcumin that was studied, and here I have an example of one thing of curcumin before I found out that usually you can get even better results. Hi Carter, hi Leslie. You can get even better results with the raw turmeric, basically, and get that in powdered form in the grocery store for very cheap. But basically, they found that the folks that were having these conditions that had turmeric or curcumin significantly improved their symptoms. And if anybody looks into the mechanisms of that, well, there's about a bazillion ways in which turmeric can lower inflammation. And oh, by the way, it's also good for helping to prevent colon cancer as well. So highly recommend a quarter teaspoon of turmeric from the grocery store, either once or twice a day, maybe 3 times a day, depending on how severe the symptoms are. Of course, balancing the dose of turmeric with the likelihood of getting some diarrhea, which occasionally happens as well. Also, oat bran was studied as a soluble form of fiber, and it turned out that the oats basically helped improve the symptoms as well. And last but not least, there's cruciferous veggies. So basically, cruciferous veggies are going to be your broccoli, your kale, arugula, and although these different plants look very different, like a cauliflower and a broccoli looks kind of nothing like a kale, you know, especially like dinosaur kale and stuff like that. Well, they kind of have a common root ancestor that we've kind of been selectively breeding all of these different cultivars off of. Sometimes it happened wildly and sometimes man-made over centuries. And that's why there's so much variety in the cruciferous veggies. But they all have wonderful anti-cancer, anti-everything properties. And we have like gut receptors for this stuff as well. So celery is going to be good in the fact of having fiber in it, but not necessarily as much of a player in some of the gut receptors, to my understanding. So anyway, and golden milk made with coconut milk. I think you're referring there, Leslie, to basically taking almond milk, plant milk, soy milk, any of them, and stirring a little bit of turmeric in it. And sometimes that can be nice, made warm as a drink as well. In fact, that's the root of my soy milk chai tea that I have every day. A little quarter teaspoon of turmeric in it and 1/8 teaspoon of ginger powder in it. And that's very, very good for helping with inflammatory conditions. Alrighty, so, well, I've covered pretty much everything that I wanted to talk to you about in the forms of helping out with some of these inflammatory bowel conditions. So remember, everybody, this is something that, although if you find the information about food to be helpful in controlling the symptoms, I would also reference you to the irritable bowel video that I did earlier as well, because that will give you more ideas to help with controlling some of the symptoms. You're welcome, Leslie. That basically it's very important to work in conjunction with your own primary care physician, because plants and plant foods can be amazing at controlling inflammatory conditions, but life happens. Something might get a person particularly stressed out. They might need a little pharmaceutical support or surgical help, and certainly relatively frequent monitoring to watch out for things like the fistulas or the scar tissue that can happen, and so forth. Oh, speaking of, actually, that reminds me of one more tip that I've found to be helpful with my folks with obstructed bowels and so forth. Well, a true bowel obstruction basically needs to be taken care of in the hospital, generally speaking, in this day and age. But I have known folks that have had some residual troubles with that, and scar tissue and stuff that's kind of built up from both the inflammation and repeated surgeries kind of makes a little bit of a mess of the belly and the inside. And basically, one of the things that can be done to kind of help smooth the path is something very simple, and that's water. Believe it or not, this may be helpful for those who are suffering. And again, do this in conjunction with your own physician. And that is the idea that first thing in the morning, immediately upon waking up, have some lukewarm or warm water. And in the beginning, when you're not sure how it's going to settle with the stomach and everything, start with maybe like a cup of warm water first thing in the morning, maybe some lemon juice or something to give it a little flavor. And then kind of gradually increase that up to maybe 2 cups first thing in the morning. And what that does is it kind of triggers and jump starts some of the bowels as well. And it can help to smooth the way so that it's a little bit easier for things to get through the system. And so I call that a water bolus. If someone's suffering from constipation, they may gradually increase that morning water to 3 cups or 4 cups a day. And again, be very mindful if you happen to be suffering from these diseases to watch your capacity, watch your own body language. The body will usually respond if something is helpful. Then you'll feel better. If something is not so helpful, and then you might get more fevers or might feel more tired and so forth. And so I hope that as this talk has gone through a bunch of variety of things that can be potentially triggering or worsening of the symptoms for these disease conditions, as well as some things that can kind of close those genes and make them turn up and be a little more quiet. Just know there's a lot of support groups out there, and there's a lot of other things that can be done to be helpful as well. So fiber, probiotics, plant foods in general. And sometimes when people have trouble with some of the insoluble fibers, which the celery would represent, because sometimes if there's an obstruction, it can be a little hard for stuff to kind of make it through. So sometimes taking some of those foods and either juicing to get some of the beneficial compounds of it, or throwing it into like a Vitamix blender or one of those other high-powered blenders to really, really break down the stuff into a fine slurry. Those things tend to make it a little bit easier through the inflamed gut than they might otherwise. So maybe smoothies with berries and so forth may be a good option as well, as long as things are very well ground. All right, well, thank you for watching, and we'll see you next time. I think the next topic that was requested was ADHD and ADD, so we'll talk about that a little bit more next week. All right. This has been another round of Doc Talk, and have a happy and great rest of your week. Bye-bye.